Are people who are regular smokers more susceptible to COVID-19?
Hi, Annalise. Yes, there's emerging evidence coming from China, from Wuhan, and from Iran and Italy that the sex ratios are far higher in males than females, which suggests, and a lot of males smoke in those countries, which suggests that smoking has a role to play in this epidemic. If you look at smokers, also they put cigarettes in their mouth, if their fingers close to their mouth, far more frequently than other non-smokers. So that's a vehicle for a virus to enter the oral cavity. So we've been looking at the evidence and at some advisory from World Health Organization this weekend to suggest that smokers are at higher risk of getting the virus and also have a higher risk of getting worse complications than non-smokers.
Is that because the nature of smoking and what damage it does to your lungs? Are they having worse health outcomes when they are contracting COVID-19?
That's right. So we've got a little bit of evidence coming from Wuhan, from China, that smokers have had, who've had their lungs damaged, have far worse outcomes than non-smokers. Also, we've got evidence from the past 20 years from other viruses that affect the lungs, where things like tuberculosis, pneumonia, flu. Those people who smoke have far worse outcomes than people who don't smoke.
Do you think this would go to explain some of the higher death rates we're seeing out of Spain and Italy with the higher smoking rates there?
We're getting sketchy surveillance data. From what it seems, we are getting more men than women being affected, so that fits with the smoking patterns in each of those countries.
But there wouldn't be stronger indication of what the connection would be between smokers and their health outcomes with coronavirus?
No, we need more work on that, but the evidence keeps suggesting that this is what's happening, and we've got a lot of evidence from other viruses that affect the lungs that this is the kind of pattern that happens once you smoke and you're introduced to a virus.
There'd be a lot of people sitting at home who are potentially regular smokers, infrequent smokers. If they gave up smoking now, would there be enough time for the lungs to build up the capacity to potentially deal with COVID-19, or is it a fait accompli?
I think it's the best time is to start stopping now. It's in Australia we have a quick line which is available nationally. It's 137848 that can assist you through going through the paces of stopping smoking. The healthier your lungs are, if you do pick up the virus, the better your outcomes will be. So, we're getting better outcomes if cancer patients stop smoking. So, absolutely, try and stop smoking as soon as you can. It's ultimately very good for you.
Professor Frederic Sitas, thank you for your time.
Thank you.